stress can be defined as a psychological and physiological response to internal or external demands that exceed an individual's coping abilities. It is a state of emotional or mental strain resulting from adverse or demanding circumstances. Stress can arise from various sources, such as work-related pressures, relationship issues, financial problems, or health concerns. Stress can manifest in different ways, including physical symptoms such as headaches, fatigue, or muscle tension, as well as emotional symptoms such as anxiety, irritability, or depression. While some stress can be beneficial in motivating individuals to perform well, excessive or chronic stress can have negative effects on an individual's health, well-being, and overall quality of life. There are several types of stress. Some major types of stress include physical stress, mental stress, behavioral stress, emotional stress. Physical stress refers to the stress that results from physical demands on the body, such as excessive or intense exercise, prolonged physical exertion, or injury. Physical stress can cause a variety of physical symptoms, such as muscle tension, fatigue, pain, and inflammation. It can also lead to emotional and mental stress, as individuals may feel frustrated or overwhelmed by their physical limitations or the demands placed on their body. Some common examples of physical stress include participating in high-intensity sports or training for endurance events, such as marathons, triathlons, or Ironman competitions. Physical stress can also result from injuries, such as sprains, strains, or fractures, which can limit an individual's ability to perform physical activities and lead to additional stressors, such as financial concerns or feelings of isolation. While physical stress is a natural part of physical activity and can have positive effects on the body, excessive or chronic physical stress can have negative effects on an individual's health and well-being. It's important to manage physical stress through proper nutrition, rest, and recovery, as well as by seeking medical attention for injuries or persistent physical symptoms. Mental stress refers to the stress that results from cognitive or emotional demands on the mind, such as intense work demands, relationship issues, financial worries, or health concerns. Mental stress can cause a variety of psychological and emotional symptoms, such as anxiety, depression, irritability, difficulty concentrating, and mood swings. Mental stress can arise from a variety of sources, including work-related pressures, such as deadlines, excessive workload, or interpersonal conflict, as well as personal issues, such as family problems, financial stress, or major life transitions. While some mental stress can be beneficial in motivating individuals to perform well, excessive or chronic mental stress can have negative effects on an individual's health and well-being. Managing mental stress involves identifying and addressing the underlying causes of stress, as well as developing healthy coping strategies to manage stress when it arises. Some common coping strategies for managing mental stress include relaxation techniques, such as deep breathing and meditation, regular exercise, seeking social support, and seeking professional help, such as therapy or counseling. It's important to manage mental stress to prevent negative effects on both physical and mental health. Behavioral stress refers to the stress that results from behavioral or lifestyle factors, such as unhealthy eating habits, lack of exercise, substance abuse, or poor time management. Behavioral stress can have a negative impact on an individual's physical and mental health and can contribute to the development of chronic conditions, such as obesity, heart disease, and mental health disorders. Behavioral stress can arise from a variety of sources, such as work-related pressures, financial concerns, relationship issues, or major life transitions. Individuals who experience behavioral stress may engage in unhealthy coping mechanisms, such as overeating, smoking, or using drugs or alcohol, which can further exacerbate their stress levels and contribute to negative health outcomes. Managing behavioral stress involves identifying and addressing the underlying causes of stress, as well as developing healthy lifestyle habits and coping strategies to manage stress when it arises. Some common coping strategies for managing behavioral stress include regular exercise, healthy eating habits, stress-reducing activities, such as yoga or meditation, and seeking professional help, such as therapy or counseling. Emotional stress refers to the stress that results from intense emotional experiences, such as grief, anger, anxiety, or fear. Emotional stress can cause a variety of physical and psychological symptoms, such as headaches, digestive problems, mood swings, and difficulty sleeping. Emotional stress can arise from a variety of sources, such as relationship issues, work-related pressures, financial concerns, or major life transitions. Individuals who experience emotional stress may have difficulty coping with their emotions, leading to further exacerbation of their stress levels and negative health outcomes. Managing emotional stress involves identifying and addressing the underlying causes of stress, as well as developing healthy coping strategies to manage emotions when they arise. Some common coping strategies for managing emotional stress include mindfulness practices, such as meditation and deep breathing, seeking social support from friends and family, engaging in physical activity, and seeking professional help, such as therapy or counseling. Common symptoms of stress include difficulty breathing, panic attacks, blurred eyesight or sore eyes, sleep problems, fatigue, muscle aches and headaches, chest pains and high blood pressure, indigestion or heartburn, constipation or diarrhea, feeling sick, dizzy or fainting, sudden weight gain or weight loss, developing rashes or itchy skin, sweating, changes to your period or menstrual cycle, existing physical health problems getting worse. Stress can be treated through a combination of different approaches, including lifestyle changes, therapy, and medication. Here are some common strategies for treating stress. Lifestyle changes. Making healthy lifestyle choices can help reduce stress. This includes getting regular exercise, eating a healthy diet, getting enough sleep, and practicing relaxation techniques such as deep breathing, meditation, or yoga. Therapy. Talking to a mental health professional such as a therapist or counselor can be helpful in managing stress. Cognitive behavioral therapy, CBT, is a common type of therapy that focuses on changing negative thought patterns and behaviors. Medication. In some cases, medication may be prescribed to help manage stress. Antidepressants and anti-anxiety medications are commonly used to treat stress and related conditions such as depression and anxiety. Stress management techniques. Learning techniques to manage stress can be effective in reducing symptoms. Examples of stress management techniques include mindfulness meditation, progressive muscle relaxation, and biofeedback.